Let's get more on the soaring cost of drugs and Martin Shkreli's appearance on Capitol Hill now. Joining us is Congressman Jason Chaffetz, a Republican from Utah, chairman of the House Oversight and Government Reform Committee. Mr. Chairman, welcome. Good to have you with us. It was a theatrical morning at the very least. You had some pointed questions for people in Mr. Shkreli's sort of cohort there. What did you learn today? And maybe more importantly, what can you do?
Well, I thought it was a good hearing. I was disappointed that Mr. Shkreli didn't choose to testify. He has taunted Congress and then said that if we just got to know him, we would think more of him. And gave him every opportunity to provide his side of the story. But nevertheless, look, when you have drugs that have rapid increases in pricing, in this case, less than $20 to more than $700, closer to $750, then you would think that basic economics would allow competition to come in and undercut that pricing and still maintain a healthy profit. But more of my focus will actually, I think, long-term be on the FDA process. We have more than 3,000 drugs that are in a backlog at the FDA. Congress had passed in 2012 legislation, nearly unanimously in the House and Senate, that allocated $1.5 billion in user fees to loosen up this process. But there's still a backlog, and drugs are not allowed to get on the market fast enough, and I think that would undercut anything that Mr. Shkreli or any other company wants to do.
This particular drug that went from $12.50 a pill to $750 a pill, or whatever the prices were, was a long-standing drug, as I'm recalling, that was basically the only drug in the market to treat whatever the ailment was that it treated. My memory fails a little bit here. So why didn't, and he bought it from another company and promptly raised the price. There's nothing to stop him from doing that if the demand is there, right?
Well, the drug was developed in 1953. It's been readily available. For less than 3,000 people a year are using it. And again, I believe in profit. I think profit is a good motivator, and far be it from Congress to go in and micromanage or set price controls on an individual company or private company. But what we also see is that market entrepreneurs would want to come in and also participate in this. But when they have this backlog at the FDA, then you have suddenly a drug used by a small population that is able to generate, in this case, tens of millions of dollars in revenue in a rapid course. I was very concerned that this company had been misrepresenting, certainly Mr. Shkreli had been misrepresenting this drug and how much they put into research and development, all trying to win the heartstrings of the American public.
Mr. Chairman.
But I take issue with that.
Do you know for a fact that other drug companies were trying to get in on the Daraprim action, so to speak, by putting an application in front of the FDA? Was that really the holdup? Because if you're coming in and threatening drug companies with potential price controls, that is going to, in and of itself, limit companies from wanting to even enter the fray to try and produce a competing version of Daraprim or any other drug for that matter.
No, the last thing I want to see is actually the government price controls in place. I want to make sure that we can maximize the companies that want to participate in these marketplaces. And when you have more than 3,000 drugs in this backlog, that's a key indicator to me that it's not just about the Daraprim, but it's the bigger, broader pharmaceutical market. And I hear from up and down, from the largest of companies to the smallest of companies, and people that aren't even in this marketplace yet, that yes, we do want to do this, but the FDA is slowing us down.
Sir, Michelle Caruso-Cabrera here. Here in the United States, as you know, we pay far more for drugs than almost anywhere else in the world, and it's because other countries basically stiff it to the drug companies. They seem to think R&D should be free, and then places like Germany, Japan, where the average income per person, these are not poor countries or poor people, they seem to think that they have the right to cheap drugs. Why in the United States, we're so focused on what we should be doing here, but why do we never use the WTO like we do when it comes to steel or any other product to fight back and say, you guys have to contribute your fair share to R&D so that we have more drugs down the road?
Well, look, our research and development has done amazing things in this industry, and think of all the family members we all have and the drugs that we use. They're vital to our health, and the United States of America is the very best place to do that. And the successful companies will invest in R&D long term, and we've got to, I think, continue to incentivize that. And I think Congress has actually done that to a degree. Now, the use of the WTO, I haven't dove into that. I really haven't. But in these specific cases, the priority review vouchers is something that we're really looking at, and other inhibitors to the marketplace. That's where we're focused, at least for me personally, on the FDA process.
But one big reason why the prices are lower in those countries is that those countries have single-payer systems by and large, number one. And number two, whether they do or they don't, they negotiate very aggressively about the prices with the American companies, something that we do not do in this country, Congressman.
I think it's a red herring and a false argument to actually go out and suggest that government price controls are going to drive down the price of drugs, nor do I think they will actually increase the research and development that is so vitally needed. The marketplace will work if companies are allowed to get in and participate. And when you have a backlog as big as they have at the FDA, I got to really question that the marketplace is really as competitive
but back
as it
to
should
Michelle's
be.
earlier question, Congressman, Melissa's earlier question, which was, do you know whether there were other drugs in the pipeline that were being stalled at the FDA that would have competed with Daraprim?
Well, there are drugs that are in the process that are not necessarily revealed and not of public knowledge, nor have we looked at that full and complete list. But what I have heard routinely across the board from industry leaders and new market entrants is that the FDA has been slowing down that process. Now, I think they've improved somewhat. We want them to be thorough. We don't want them to just automatically put a stamp on it.
But these are two different issues, aren't they? I mean, the FDA can be slow, but I mean, help us understand
You want them
this.
to be thorough, right?
Are there any drugs that would actually come in and compete with the likes of a Daraprim or another drug in the market that is overpriced in your view?
Well, look, dealing with the problem that Daraprim actually helps to solve is a very small marketplace. And I think the point was actually, this is why it's a healthy dialogue to come in there and say, there hasn't been any innovation in this because it does serve such a small marketplace. And so was the $17.50 that was there before, was that an adequate price? Maybe not. Maybe it should have been more. Now, I've had Mr. Shkreli say, at least publicly, that the one mistake he made is he didn't raise the price high enough. But we tried to ask him these questions, and he came in and pled the fifth. I mean, he obviously thinks he's done something criminally wrong there that he doesn't want to talk about.
Congressman, it's not the only person that is not talking. I'd like to switch gears, if I can, sir, and talk briefly about Flint, Michigan. Because you have said that you are going to hunt down Darnell Early, who was the emergency manager in charge of the water switch, which may or may not have given Flint their lead-poisoned water. Have you been able to serve Mr. Early directly with a subpoena? Will you get him to Washington?
So last week I noticed the hearing. He said that he wasn't going to hear, so I signed a subpoena. We tried to serve that electronically to his attorney.
Who turned it down?
They refused. He turned it down. We asked the U.S. Marshals to hunt him down and serve that. I've been told in the last hour that they actually found him, and they have served him that subpoena.
So Darnell Early of Flint, Michigan has been served with a subpoena, and you would expect him to honor that and show up for a hearing?
Show up for a deposition. We gave him a date specific. I don't recall what the date is right off the top of my head, but he has been served that, and he will come to Congress, both sides, Republicans and Democrats, 1 hour at a time. We'll ask him questions under oath.
Sir, I wanted to get your comment on, or what you think about what Martin Shkreli tweeted out after his appearance and his lack of willingness to answer questions. He said, hard to accept that these imbeciles represent the people in our government. He called you imbeciles, sir. What do you think of that?
Well, it's sort of a childlike behavior. We gave him every opportunity to cite his side of the story. He chose not to do that, but it's disappointing. But
his attorney called him a hero.
More of a human being, but
his attorney called him a hero.
Yeah. Yeah, but if he pays his bills, I'm sure he thinks he is a hero, because I'm sure it's not cheap. So, you know, whatever.
But let me just get the bottom line, Mr. Chairman, because you also talked to the CEO of Valiant Pharmaceuticals, which has also come under scrutiny for drug pricing. What exactly do you want to happen? Because it sounds like you do want to allow the free market to operate. You do want prices to increase so it can draw their competitors into the market, but you don't want any price controls. What's the ultimate goal of all these hearings?
Look, people want to be able to have improved quality of life and access to pharmaceuticals and getting the overall rise in drug pricing. That's a huge issue for people. You ask anybody on the street, are your healthcare expenses going up or are they going down? They're going up. I mean, the president promised us that these things were, if we just do the Affordable Care Act, everything will go down. So people will save $2,500 a year. I'm not aware of anybody saving that kind of money. So we're going to continue to look at this. I didn't expect to have one hearing and solve all the world's problems, but I think it was very enlightening, and we'll continue to move forward.
Congressman Chaffetz, thank you very much for your time today.
Thank
We
you.
appreciate your coming
Thank you.
on CNBC.